Vaccinations continue in our province, but the messaging about who is eligible for what hasn't been very clear. With a delay in a Pfizer shipment, more clinics are offering doses of Moderna in its place. For more on how the second dose strategy is going, I'm joined now by infectious disease expert, Regina physician, Dr. Alex Wong. Thanks for being here.
Thanks, Sam. Always a pleasure.
Let's clear the air. Who is eligible for what when it comes to second doses?
So as of tomorrow, it's going to be pretty simple because as of tomorrow, basically everybody ages 12 and over who has received a first dose at least 28 days prior will be eligible to receive their second dose. So that's going to really kind of make things a lot more simple kind of going forward. So you're eligible to book an appointment, or you're obviously eligible to attend a pop-up clinic or a walk-in clinic or a drive-through.
Now, are there any risks with mixing doses? Because that's the big conversation this week.
So obviously there's been a lot of stuff kind of changing with regards to sort of mixing and matching doses. So just for clarity, if you receive the first dose of AstraZeneca vaccine, then you're eligible to either receive a second dose of AstraZeneca vaccine or a second dose of either mRNA vaccine, either Pfizer or Moderna. We would say right now that the mRNA vaccines are preferred, but there is definitely a choice there. If you received a first dose of an mRNA vaccine and you're over the age of 18, so regardless of whether or not you got Pfizer or Moderna, you can receive a second dose of either Pfizer or Moderna. We consider the mRNA vaccines to basically be equivalent and interchangeable. With some of the challenges right now with supply of Pfizer, Moderna is very, very reasonable for people who receive Pfizer as their first dose to be able to get Moderna as a second dose.
And then there are those under 18.
So yeah, that's a little bit different. So for under 18, it's only Pfizer that's available because that's all that's been approved at this point in time by Health Canada. So if you're between the ages of 12 and 17, yes, you do need a second dose of Pfizer. And so some of that is probably going to depend on supply. There may be a bit of a delay, in getting second doses into kids between the ages of 12 and 18 until we have a better supply of Pfizer in the province.
Let's talk about kids under 12. There are a lot of concerned parents as we approach July 11th when all restrictions and mask rules just disappear. What do we know about when kids under 12 may be eligible for vaccinations?
So Pfizer is the company that's kind of pushed their clinical trials the quickest, and so we expect them to sort of have the earliest sort of top line data that they're probably going to release as soon as probably sort of September, October of this year. So once that data is released, and that's sort of like the immunogenicity data, so whether or not there's an appropriate antibody response in kids and whether or not it's safe in kids, we would then expect that they would apply for approval through Health Canada and other regulatory bodies. And then from there, we would expect eligibility. So realistically, I think it's certainly conceivable to see vaccines starting to go into kids under 12, particularly Pfizer-BioNTech, before the end of this year.
And finally, I wanted to get your perspective on the Delta variant. We know in some places it's become the dominant strain. What can you tell us about its presence in Saskatchewan?
So we know that it's definitely here. We're not sequencing all of our cases at this point, so we don't know with complete certainty exactly what the prevalence is at this point, but we know it's basically inevitable because it's more transmissible. It's taken over as a dominant strain in places like the UK, for example, certainly even in parts of the US as this alpha variant is kind of going away. So we know it's inevitable that it will become our dominant strain. It's about 40 to 60% more transmissible than the alpha variant. So it's going to be here. It's just really kind of a matter of time. We don't know exactly how much time there is, which is why, again, I think it's really important to stress the importance of getting first and second doses into people as quickly as possible, and to certainly watch closely as July 11th approaches and we're looking to remove all of the various restrictions in place, including masking.
Thank you for your time, Dr. Wong.
Thank you, Sam.
Dr. Alex Wong is a physician and infectious disease expert in Regina.